All right, so I'm starting part two. I noticed I was at 30, 30 minutes or so, and I don't want these to get too long. And I said, well, if I start on this, they might get too long. So thank you. So we're picking up on, I think it's page 8, which with that metrorrhagia, the vaginal bleeding at frequent irregular intervals. So what would be the most common reason? If I had to pick the most common reason someone would have this, probably caused by birth control pills. So a lot of times you use birth control pills and you're going to have a cycle, but it's going to be kind of off and irregular. It's going to vary depending on the type of birth control you use. Typically it's light and irregular, but it can vary from woman to woman. Okay, so that could be part of the reason. There could be, we'll talk about the fibroids or polyps. There could be scar tissue. Let's say you had some procedure done. Let's say you have previous surgery for fibroids or polyps, or maybe there was previous cancer. Anything that could have caused scar tissue, any kind of exam that went wrong, could have caused scar tissue, and you could have frequent irregular bleeding. So, you got to ask a lot of questions, get a lot of history from someone, but always make sure you ask about the birth control pills. Note which pill they're on, and then try to pin down exactly the length of their cycle. And polymenorrhea, frequent periods with a regular flow. So very short cycles, less than 21 days. Most of the time, this is going to be caused by your sexually transmitted diseases, probably chlamydia or gonorrhea, because they cause inflammation in the uterus, and you tend to have this short cycle. These also, by the way, then lead to pelvic inflammatory disease. All right, so that's where I would be with the polymenorrhea. And then amenorrhea, just the absence of periods. And what's at the top of the list with that? Probably the most well-known of these abnormal uterine bleedings. I would say the people who don't have enough body fat, anorexic, athletes who are very low body fat percentage, don't have a period. And then you have just menorrhagia, just heavy bleeding. So women with menorrhagia have a regular cycle interval with excessive bleeding greater than 7 days. Soaks a pad in 1 to 2 hours. Okay, so which is mentioned up there that we already talked about. What's normal? What are we talking here? Greater than 80 milliliters of blood. Uterine anatomic defects leading to menorrhagia. So let's talk about if you have menorrhagia. You see I put some NMD notes down there. And these are just some things that if someone has heavy bleeding, okay, if someone has a heavy cycle, things that you should probably discuss with your patient. Like I mentioned earlier, iron deficiency. If you're losing blood, you need to make sure you test that iron level and ferritin. Ferritin is your storage iron, and you want to get an idea of how much iron is actually stored. So here's the reason for that, okay? So this is something that a lot of just regular docs don't do. They don't do a thorough analysis here. If you check your iron level, and let's say the iron level comes back okay, or let's say it comes back on the low end, but you check your ferritin level, and your ferritin level, which is the storage iron, is really high. Would you give someone iron or not? Okay, case-by-case basis, but I probably would not give them iron if their ferritin is going high. Okay, I would not give them iron if their ferritin is really high. So I'd like to see ferritin be low, along with a low serum iron. Why wouldn't I give ferritin, by the way? Ferritin, high ferritin is a marker of something else going on. So I don't want to feed a problem. You also, if someone has heavy bleeding, I definitely want to check that thyroid. So something as simple as having a thyroid that's off could be why you have heavy cycles. And when you test the thyroid, you'll probably hear me mention this a lot throughout the course. You need to check 4 specific thyroid hormones. I listed them there: TSH, free T3, free T4, reverse T3. And then get them a prescription from somebody who knows how to look at those values and determine what's going on. You're looking at the relationships between those 4, not whether they're just low or high. You're looking at the relationship. Vitamin A also is something that is supportive of heavy menstrual cycle. One of the things you want to analyze if someone has an excessive amount of arachidonic acid in their diet, right? And where does that come from? Animal products. So if they're eating an excessive amount of animal products like red meat, that could be a cause. And they need more of the, omega-3 fats. So increase omega-3 and fish intake. So replace any arachidonic acid in their diet with omega-3 and fish, and that's going to go a long way toward helping. Vitamin K, what does vitamin K do? Vitamin K is involved in helping your blood clot. It's kind of rare for someone to be deficient in vitamin K. It's not impossible. Maybe they just need more. So make sure that they have plenty of vitamin K in order to create the clotting factors in your blood. And obviously, if someone's losing blood, you got to make sure that they have enough building product to make more blood. So make sure they have adequate protein in their diet. So that's just real simple. Then you have to go person by person to say, well, what else does this person need? But if you look at these items right here, right, when you're looking at a patient and saying, okay, this person has a really heavy cycle, they're doing a lot of bleeding, this is what you investigate, and this is what you can use to treat them. And it's going to move you forward. All right, and then we go to the next page, and we have this uterine fibroids. Uterine fibroids. And this is a good drawing because this is important to understand that a uterine fibroid, remember fibroid, think fibrous, think muscle tissue. So that's in the what? It comes from the myometrium, right? Myometrium. And they can be anywhere, right? Obviously, if they're a little polyp like this coming out of the surface, fairly easy to remove. They can do something called a colposcopy, and they can go in. It's a very specific device that goes in with a tube, and they can put different tools on the end of that, and there's a scope, and they can pretty much like snip that off. If it's in the wall, it's much more serious surgery, and this is when they'll start just suggesting someone get a hysterectomy. Okay, so good picture showing the different places that this could take place. So obviously, if it's just an intramural, just right in the middle, okay, not affecting too much, but you see the submucosal, that's going to affect the implantation of an egg and the pregnancy. And if it's a subserosal, so it's on the outside of the uterus, we're always concerned that it's going to break through, okay? And now we have something that is taking up space. Whenever you have a growth that's taking up space, it's putting pressure on things, and you could have pain or discomfort, pelvic. When we talk about chronic pelvic pain, we could have a very large fibroid. Sometimes you hear stories about these being as big as softballs, okay? So there will be pain. So again, fibroids, muscle layer, polyps, when we get to it here, the endometrium, the inner layer. And that inner layer is that light color on that picture. And you see down here risk factors. Estrogen dominance. Estrogen dominance. Okay, and actually, these are kind of have a lot to do with both progesterone and estrogen. Estrogen more so than progesterone. So estrogen dominance, being overweight and obesity. Why? Why is that? Because when someone's overweight, they have a lot of body fat. Fat is also estrogenic. Fat is estrogenic. You make a lot of estrogen. Nulliparity, never having given birth. We'll see this in a few of these pathologies. Why is nulliparity an issue for cancers? Uterine cancer, ovarian cancer. Why is nulliparity a risk factor? Anybody know? Okay, well, the reason being is that if you've never had a pregnancy, you've had more cycles of estrogen production. You've had more cycles. Okay? So breast, ovarian, uterine cancers, your risk go up because your body has never had a break from having all the estrogen. So when if you had one child, all right, so you had 9 months of break. But point being is that's why they say the risk is higher because you've had fewer cycles. I'm sorry, you've had more cycles if you hadn't had a pregnancy. Early menarche prior to age 10. And why would that be? Because you've had more cycles, just so someone who's nulliparity. You've had more cycles. Okay. And then statistically, African heritage, 3 times more common. Okay. Treatment. So some fibroids require no treatment and they can go away on their own. So you have to determine where is a woman in her life cycle. So we know that these fibroids and the polyps, when we talk about them, are being fed by hormones, estrogen predominantly, some progesterone. So if you can wait to postmenopause time, you're not making any more hormones, and the fibroids will shrink on their own. So that's one of the things that people have to decide on their own. Do I want to wait and see what happens? Right? Can I wait? How old? Oh, I'm only 42. Ooh, average menopause hits around age 50. That's a long time to be uncomfortable, and you have to make some real decisions. Okay. Whether you just go in, try to remove the fibroid, you have to talk to the surgeon. Just remove the fibroid itself. Is it in that myometrium? Can you get it? Is it easy? Or is he going to say, yeah, it's really involved because of the size, because of the shape? I suggest you just do a hysterectomy. A lot of decisions have to be made depending on your age. Do you still plan on having more children? There are some drug treatments, things that block estrogen and progesterone. And you can have a drug-induced menopause. And then fibroids can shrink. But then, of course, at an early age, you'll have all the signs and symptoms of postmenopausal signs and symptoms, right? Vaginal dryness, everything that we've talked about so far. You run the risk of osteoporosis at an earlier age because you don't have as much estrogen. So a lot of decisions that have to be made when you're doing this. Referral. So if someone having, these are pretty, I think, self-explanatory. If someone's having irregular heavy menstruals or bleeding in between cycles, you need to get them to somebody. Can you, during this time, do TCM treatments? Yeah, but make sure some other practitioner is involved. right? Chronic pelvic or abdominal pain. You don't want to see what you can do with TCM with these particular issues. Fever or night sweats, that's a red flag, right? That could be an infection, right? So that's really serious. Increasing abdominal girth tells us that fibroid is really growing. Now it's gone from baseball to grapefruit to melon size. And any kind of concerns about pregnancy or inability to become pregnant. If for whatever reasons they're trying to get pregnant, it's just not working. They might have some of these signs or symptoms. Their periods are abnormal. You might want to refer them to somebody. You still can work with them, if you're doing infertility treatments, or if you just have a good protocol that you learned while you're in school. Don't ever be afraid to do your treatments with someone else. I mean, because it has the potential for making your protocol work more efficiently if you have someone else on board who's addressing the other issues. You don't have to try and go it alone because you don't want someone interfering. The more people involved, the more potential for your protocol to be successful too. So get other people involved. It's all about trying to get the person healthy and where they want to be. And then refer to emergency. Okay, I mean, obviously excessive menstrual bleeding for sure. Prolonged pelvic pain. Yep, dizziness, lightheadedness, shortness of breath. That's always an ER visit. Chest pain, and on top of it, vaginal bleeding. That's that third one. There's everything that sends someone to emergency room. Vaginal bleeding when someone's pregnant. Never a good thing. So that is ER visit. All right, so keep that in mind. So naturopathic treatment. If someone has, fibroids or polyps, when we get to that, same kind of process, but they've been to the doctor. The doctor has done an examination, maybe it's ultrasound, maybe colposcopy. They looked at this situation. They have given this individual options, and she's trying to weigh the options. What can you suggest to start doing for them? All right, because maybe they don't have their mind made up. Maybe they say, well, I have some time. The pain isn't that bad, or the bleeding isn't so bad. It's not excessive, but I know I have the fibroids, and maybe it's just worse when I have my period. What could they do? Okay. So first of all, you got to look at their age. How close are they to menopause? Okay, because we know they'll shrink when they become postmenopausal. The other thing that you want to do is you really want to make sure you're supporting the liver. Okay, so why the liver? Okay. Well, here's the thing. The liver is responsible for breaking down the excess estrogen. So sometimes if there's a female who has a problem with an excessive amount of estrogen, and you can do blood tests and you can kind of see, it could be because their liver is not breaking down the estrogen in a timely fashion. So the levels could be high, especially which is the bad estrogen? Estrone. Okay, so check their liver enzymes, see what's going on there. Check their estrogen level, all three, mostly estradiol and estriol, unless they're pregnant, it's not going to be high. But see what those levels are. And then support the liver. Now we want to give them some things that will help the liver break down estrogen. The go-to product, well, let's talk nutritional first. What's the go-to product for this? It would be broccoli. So broccoli is your go-to product. But supplement-wise, you want something called I3C or Indole-3 carbonyl. Take this at whatever suggested dosage is on the bottle that you get. And then there's something called DIM, D-I-M. Long word, forget what it is. But I3C and DIM, usually they'll come together in the same supplement. Okay, and this will help break down the estrogen. Now, the other thing you can do is give these women phytoestrogens. So what do phytoestrogens do? Well, phytoestrogens will sit on the estrogen receptors because they have the same molecular structure. And if they're sitting in there, they're blocking estrogen from getting there and inhibiting growth. So that's what phytoestrogens do. And you can buy the supplement as is. You can give them soy and flax. Those would be the kind of two go-to products, nutritional products. Or you can get a supplement itself that's just phytoestrogens. And they'll probably contain soy or some herb. There's a lot of herbs who are phytoestrogens as well. So know that that's a strategy as well. So you want to make sure you give support for breaking down estrogens, and then you want to provide phytoestrogens to help sit on those receptors and block the estrogen. And there I listed my little list of support the liver, always NAC and I3C, indole 3-carbonyl, and DIM. You see that long diindolylmethane. Phytoestrogens, soy and flax, and then make sure they're getting quality fats and reduce the bad fats. That's important. Back to that arachidonic acid issue. Make sure they're not eating tons of red meat or junk food, which has all the bad fats. Okay. So nutrition plays a little role in there. All right, neoplasms. Endometrial / uterine cancer. So abnormal growths. Neoplasms are new and abnormal growths of tissue in an area typically associated with cancer. Cervical and uterine cancers can both cause menorrhagia, bleeding, heavy bleeding, bleeding after menopause. Okay, so the risk factors, obviously you'll have pelvic pain, painful intercourse. But risk factors, again, that estrogen dominance, more years of menstruation, so you've had more estrogen in your body, longer periods of time, more cycles, never been pregnant again, age, and obesity. That's for the endometrial cancer. For cervical cancer, it's that HPV. Now, of course, this is why females will get a pap smear to check the cervical opening. And there's a little brush that you use to scrape off cells in the opening in the cervix, and you send them away for testing, and they can see if there's any unusual cells there. And diethylstilbestrol, that DES, this was something that you'll see this pop up every once in a while. It can't be too long. I don't think it's going to be an issue. So back in the, I think 60s and 70s, DES was used to help with morning sickness when women got pregnant. They didn't know any better, but what they didn't know was it causes birth defects. But it can be passed on. Okay, it affects the child, and they could have increases their risk for cervical cancer. But most of those people who were born during that period of time are probably getting are your senior population now. Okay. So just know every once in a while you might come across somebody. Yeah, my mother used DES. When she was pregnant. You'll find those people. And of course, herpes, smoking obviously increases any kind of cancer. You get older, risk goes up. So treatment, surgery, hysterectomy is usually partial or radical. Partial is what? When you just say take the uterus, okay, and you leave the ovaries. That would be more important when someone is premenopausal. Someone's 35 years old and there's, uterine cancer. Maybe you can save the ovaries and still let them have that hormone production. And then hormone therapy is used to block the production of hormones that encourage cancer growth. But radiation, chemotherapy, or hysterectomy, if it's fairly well contained, all right there in the uterus, that might be a better option versus if it is kind of spread. It's just not right in the uterus. It's now in the tissue next to it. Sometimes the surgery becomes more intricate, and they'll want to do like radiation first to shrink the tumor. Referral. It's always good. You get family history of cancers. Find out, from everybody you talk to, any history of cancer in your family. Any kind of weight loss, unexplained. If someone's losing weight, and they're not trying to, that's never a good sign. Or just loss of appetite, and that's usually why they're losing weight. But they still may be eating a lot. Just remember, cancer cells gobble up calories. So you say, man, I don't know, I'm eating, but I'm still losing a lot. Because the cancer cells, if that tumor is large, it's really burning through a lot of calories. Fatigue. Night sweats, always a sign that there is something amiss. Night sweats is never a good thing. Tidal fever, unexplained vaginal or rectal bleeding. Any kind of unexplained bleeding is always case for referral. So I just put on here in my NMD notes here for endometrial cancer. One of the things that should be investigated, again, they just find connections, is the blood sugar management. Make sure that you are adequately, don't have a blood sugar dysfunction. So you want to check the fasting blood insulin levels. So why? What would be the purpose here? So if you have high insulin levels, which would indicate what? You probably have diabetes or you're moving in that direction. But insulin is a growth stimulating hormone, growth stimulating. Fat cells for one. Okay, but any cell, if you have lots of insulin, you're going to encourage growth of cells, including cancer cells. And what do cancer cells love? Glucose. They love glucose. So you really, if you have any type of cancer, and not just uterine cancer, but that's what we're talking about here, you need to make sure that your sugar is kept as low as you can. You need to really work on blood sugar management. And again, same thing. You want to start managing those possible estrone levels, the bad estrogen, estrone, and make sure you're breaking it down. The NAC, the I3C, and DIM. Green tea extract, it has the EGCG content. That is my go-to product. Someone mentions just the word cancer, boom, they're on a lot of green tea. There's a lot of studies out there show a lot of efficacy with the green tea extract. You can drink green tea, but the concentration is not as great as it is when you're actually taking the supplement. And of course, and the EGCG does what? Inhibits proliferation of cancer cells. And of course, omega-3 fatty acids goes without saying. So that's my little synopsis. If you have endometrial cancer, any type of cancer, that sugar issue is important. Just from here on out, you can remember that. But we're talking specifically about uterine cancer. And I hope you understand why that is crucial to get the sugar under control. Number one, what? Cancer loves glucose, and insulin is what stimulates cells to grow. All right, so then there's a little section on IUDs here. As far as birth control, right? Which is great because you don't have to worry about your messing with hormones. right? A lot of women don't want to take birth control pills because they don't want the imbalances and irregularities. So this is a possible type. Now there's two types. There's it says in here copper hormonal. They can implant hormones on there. That can be very supportive. Typically, my experience with women, I've not placed these, but I've had friends and patients who have. I would say, in general, most women experience for the first few weeks kind of some abnormal bleeding. And then it does level off. And they're saying over here, abnormal bleeding typically subsides within 3 to 6 menstrual cycles. So, 3 to 6 months, yeah, possible. So what does an IUD do, by the way? So it prevents pregnancy because it doesn't allow the sperm, right, to get up in that fallopian tube to fertilize the egg. And then it also makes the egg have a harder time to implant in the uterus. Harder time to implant in the uterus. And then sometimes, like if we're doing it for birth control, it can be coated with progestin, which, remember we talked about the cervical mucus earlier on. If it's coated with the progestin, it thickens the cervical mucus, right, and thins the uterine lining, right? So that's what progesterone does. So you're thinning the lining so you can't get implantation, okay? And if the mucus is thick, the sperm can't get through. Right, so that's why we're checking that. I don't think I mentioned that earlier when we talked about the mucus. Why do we want it really thin and slippery? Because that's how the sperm can get through. If it's thick, the sperm is not going to go anywhere. Uterine and cervical polyps. So kind of the same things going on here when we talked about the fibroids. Other than what? Polyps are what? Endometrium in origin. Okay, so just keep that in mind. That's an easy test question on maybe a national exam. What's the difference? And they're going to give you some options. Polyps, they start in the endometrial lining. Fibroids start in the myometrium, or the muscle tissue. Cervical polyps tend to occur in women over the age of 20. You see, cervical polyp is what's coming out of the cervix there. Is that opening? That's os, os. That's called the os, the opening. And that opening there, I'm looking at the picture, is where you take the sample for a pap smear. You take a little brush that fits in there and you scrape off some cells and you look at those and you're looking for that HPV. Okay, even though you're not doing it, it's good to understand what's taking place so you can talk to people who might have questions. And if they're just out like this, if you look to the cross section, they can be just surgically removed. That's a fairly straightforward polyp issue. If there's excessive bleeding, they're going to need to have some kind of treatment. And I'm going to just mention my NMD notes and I'll stop for here. Same type of suggestions that we talked about for the uterine fibroids. Same supplements, NAC, right? We want to use the I3C and DIM to break down the estrogen so there's not excessive amount. And support the body, limit the arachidonic acid. All right. So this will be the end of part 2. And we'll kick off endometriosis on the next video. All right. Thank you.